Welcome to today's on-series session, Beyond Best Practice, an award-winning injury management system. The Office of Industrial Relations provides free education to stakeholders within the Workers' Compensation Scheme in Queensland to improve rehabilitation and return to work outcomes for businesses and workers. Our presenter today is Juan Corredor. Juan is the Human Resources and Safety Manager at Darwalla. Juan is representing Darwalla today to share their injury management system. See what tips you can implement into your injury management system to support your workers and business in getting workers back to work after an injury.
Thank you for listening. Let's talk about Darwalla and our injury management system. Darwalla is an integrated poultry producer with sites across southeast Queensland and northern New South Wales. Operations consist of a hatchery, breeder farms, broiler farms, live bird catching, feed mill, live bird transport and feed transport and maintenance workshops. We are a large culturally diverse organization which has presented unique challenges. These challenges have been met with novel and successful strategies to ensure compliance for a range of legislations in the high-risk agricultural sector. We use a holistic approach to rehabilitation management. This covers them from their whole of employment life, from pre-employment, induction, daily duties, employee development, and employee support. We're fully committed to our injury management system and support, develop and empower not only the injured workers, but ensure that all team members are involved in the process of rehabilitation through training and mentoring each other. We designed and implemented a customized long-term, sustainable, fully integrated rehabilitation management system to meet the unique nature of our operations. The system is beyond best practice, with the cornerstones of our system being training, worker support, collaborative networking, and communication. The system has embedded the principles of risk management into all areas of the operation to ensure compliance with several legal requirements. We promote return to work through awareness of the Darwalla rehabilitation and safety system, starting at the commencement of employment using role-based inductions. All workers undertake a two-part induction program, Part A and Part B. The Part A, it is a day one induction of an employee and are customized for each department. As there are different risks associated with different roles, the Part A induction covers general information on the role, includes health and safety, responsibilities, reporting, and the principles of rehabilitation. The Part B induction, it is a monthly induction. It includes the CEO, David Greaves, who every new employee meets at the beginning of the induction. Information is more comprehensive and expands on the principles and practice of Darwalla's rehabilitation system. It also explains the importance of training, reporting, worker support, and collaborative networking to sustain the rehabilitation system. We ensure that all workers within the organization are aware of the rehabilitation system, policies, procedures, and the reporting process by undertaking targeted training. The rehabilitation and reporting training is undertaken at the commencement of employment, and a refresher training is undertaken annually. Returning an injured worker back to meaningful work needs more just than paperwork and procedures. It relies on positive attitudes, supportive workplace relationships and friendships, and the active collaboration between employers, workers, doctors, and others. Ultimately, everyone should strive for a partnership approach to managing injuries, where there is trust, support, and an openness to regularly communicate and share information with one another. Some of the components of the worker support phase are supportive workplace culture, rehabilitation coordinator, early intervention, rehabilitation pack, psychological or mental health support, support from co-workers, redeployment. A supportive workplace culture is key to managing workplaces more enjoyable and somewhere that injured workers are motivated to get back to. Injury management is highly interpersonal and requires active collaboration and cooperation between all involved. The rehabilitation team is composed of the injured worker, the departmental manager, the rehabilitation coordinator, doctor, work cover case manager, an allied health professional, for example, an OT, and the co-workers. Effective injury management relies on the cooperation of all involved. When everyone understands the responsibilities, active and full participation in the injury management process is much easier to achieve. There are a range of suitable duties across the company. The tasks assigned to the injured workers are dependent on their functional capacity as designated by the doctor or allied health professional. The rehab team uses the functional capacity supplied by the doctor and cross-references with the functional demands, assessment, available tasks, and roles across the company. Here we develop several channels of communication. We have daily toolbox meetings, a Connects portal, Darwalla Way, lessons learned, and connecting Darwalla. The daily toolbox meetings is information relating to safety, and anyone under a rehabilitation plan is communicated to all team members, and the suitable duties plan is displayed on the Departmental Visual Performance Management Board. The Connects portal provides a central communication hub where workers across the organization can access their personal information and can receive communications from the company. The Darwalla Way, once an improvement project is conducted and concluded, Darwalla designs and distributes the Darwalla Way flyer. These flyers contain information relating to the improvement and the benefits the improvement will bring to the people and to the organization. The lessons learned, basically following the investigation of the cause of an incident or an accident at Darwalla, we design and distribute a lessons learned flyer. This flyer contains non-identified information relating to the incident, the cause, and the methods of preventing the reoccurrence of the incident. And lastly, connecting Darwalla. It is our Darwalla newsletter, basically. All of them, the Darwalla Way, Connecting Darwalla, and Lessons Learned, are distributed across the organization and displayed on each department's communication section of the Visual Performance Management Boards. Some of the main initiatives implemented in order to improve outcomes to injured workers are role-based functional demands assessments, role-based pre-employment assessments, rehabilitation packs, preferred medical health professionals, and host employment opportunities to assist non-Darwalla employees, among other initiatives. Okay, let's talk about the role-based functional demands assessments and pre-employment assessments. One of the major initiatives which forms the core of the Darwalla rehabilitation program was the design and utilization of task-specific functional demands and pre-employment assessments. All roles and tasks within the organization were assessed, and using this information, role-specific pre-employment assessments were designed to ensure that the staff undertaking various tasks have the physical capacity to undertake the role. The functional demands report were also used in the formulation of the job safety analysis, which were developed for every section within the business. Information relating to the physical capacities are also used in the rehabilitation process to design customized suitable duties plans. Now, the other initiatives are the rehabilitation packs and preferred medical health professionals. Darwalla's rehabilitation program includes a rehabilitation pack, which contains all relevant information and documentation which a worker requires immediately post-injury. This kit includes the tools and information an injury worker needs in order to demystify the process and make it less daunting from the beginning. Due to the specialization of the roles performed, Darwalla provides preferred treating doctors with the functional demands to assist them with early return to work plans. We say preferred training doctors, however, workers are able to visit their own doctor. We recommend they take the rehabilitation pack to their doctor to support their management and their return to work goals. All right, host employment opportunities at Darwalla. Since we joined the Work Cover Host Employer Program, Darwalla has hosted several workers who have undertaken various roles within the organization. Most of the workers successfully complete the long-term suitable duties program with Darwalla and have found alternative employment. Darwalla works closely with Workover and allied professionals in order to ensure the host employees' cases are managed in a timely and efficient manner. To be invited to join the Workover Host Employer Program validates our rehabilitation system is beyond best practice. Now let's talk about the benefits. The main benefits of our injury management system are better engagement, better performance, external recognition, and a vastly improved safety. Better engagement, we have increased level of reporting and injury management across the company. We have seen a much more positive attitude towards health and safety and a greater ownership on safety matters and an open communication and feedback. On the performance side, in the past years, we have experienced the best safety results in the history of the company. We have reduced our workover insurance premiums, and our rates are much lower compared to the industry. External recognition, we are recognized as leaders in the industry, and we have had the opportunity to share our lessons learned at various networking events. And also, Darwalla has been used as a case study in a couple of occasions for the agricultural sector. And lastly, but I believe the most important part is we have improved our safety. We have a 37% reduction in number of lost time injuries in the past 3 years, 36% reduction in medically treated injuries in the past 3 years, and in general, Darwalla has decreased the exposure to liability by increasing supervisors' and managers' awareness of health and safety matters.
Thanks Juan and Darwalla for sharing the award-winning Beyond Best Practice Injury Management System. We encourage viewers to send any questions or feedback about this session to wcr.education@oir.qld.gov.au. Thank you for listening.